They are born or they are made, they grow, they increase in numbers, and they take their time and they die. They have a span, and they die. So the same thing, you see, when you go for a scrub, like as women go for facial scrub, we are just getting off dead cells. When you're combing your hair and you see the hairs in your comb, those are dead cells. Na lazima zife, zitoke, then others grow, and that is the process. It is a process. So when these cells overgrow, and they increase in number more than they're supposed to be in a certain place in our bodies, that is what can progress to cancer. Because it starts as a growth and then it becomes cancer. So now, for cervical cancer and breast cancer and all these other cancers, in the whole of our human body, unaweza pata cancer apart from two places. Kwa nini na nini? Kwa jino, you cannot get cancer on your teeth. Yes. Yes. And the hairs. So it is very important to know now that. Now, the other thing about cervical cancer and breast cancer, cervical cancer, as I started saying, it is the only cancer we know what causes it 99%. And it is the only cancer that is 100% curable.
Hey!
Yes, and preventable if you catch it early. The gist is, if you catch it early. Yes.
Because there is already a known cause.
Yes. Now, 99% is caused by a virus we call human papilloma virus. In human papilloma virus, wanaume wanabeba. Men are carriers. And then women get the disease. So what happens, every woman, if they've been exposed or they've had sex in their life, they get infected by this virus. If the man had the virus. So when you're infected with this virus, 80% of these women who've had sex will be exposed to this HPV virus. But 80% of these women will fight it because of the immunity that we have. Unaona kama homa, ukipata homa, unajua virus haina dawa, by the way. We just treat the symptoms. Like you're having a headache, we give you dawa. So for the HPV virus, 80% of these women will fight it. Using the immunity they have. But 20% of these women will not fight it. So they will get the virus. And this is after infection and infection. You know, you get infected today, you fight it, you get infected. After 1 week, again, you fight it, you get infected.
So the body gives up.
So so these frequent infections of HPV virus will eventually make you get cancer. As I said, you remember it's overgrowth of cells. So this infection, of course, what happens to an infection? There is inflammation. When you get infection, there is inflammation. So when there is inflammation in any particular of our body, when there is infection, inflammation, what happens? Kuna uvimbe, kuna kufura, kuna joto. So what happens? There is overgrowth of cells. So these cells overgrow and overgrow now, they start becoming cancer. Now, the other thing about cancer of the cervix is very unforgiving. What I tell people is cancer, once you get cervical cancer, is very unforgiving because it gives you a lot of time for you to take care of it. When you start getting infected with HPV virus over and over and over, and now it starts getting infected, your body cannot fight. It will take 10 to 15 years for you to develop that cancer. 10 to 15 years. 10 to 15 years is a very long time. So you're like, this cancer is like, hey man, I've given you a very long time to fight me and you haven't fought me. So it's very unforgiving. Cervical cancer is a cancer that is very unforgiving. Look at it this way. Where is the cervix in a woman's body? Because the cervix is found in a woman's body. The cervix anatomically is placed between the urinary bladder and the anus or the njia ya choo. So the cervix is katikati pale. Kumbuka cervix ni mlango wa njia ya uzazi.
Sure.
Yeah. So it is the entrance. This is a very beautiful organ. This is where every one of us passed through. Ni mlango Wakati mama yako alikuwa anataka kujifungua wewe, huo mlango ulifunguka.
That was the door.
Yes, so that you can come out.
I came to this world.
Yes. So it's a very beautiful organ. So you can imagine mahali iko katikati ya bladder na anus ama tuite, let me call it an anus. So it is at the middle. So what happens when it gets cancer? Cancer, as it grows, it becomes a wound. Kidonda.
Okay.
Sawa. Kidonda ndio iendelee kuwa, if it is not getting healed, it grows, right? Kidonda huwa ina grow, si ndio? So it can grow forward, or it can grow backward, or it can grow sideways. Si ndio?
Yeah.
So what happens when this wound is growing forward? Which organ is it meeting? The bladder. When it is growing backward, which organ is it meeting? The anus. Si ndio? Yes. So what happens? Inatengeneza kidonda kwenye bladder na inatengeneza kidonda kwenye rectum.
A mess.
A mess. So what happens? There is communication between the bladder and the rectum and your cervix. So what happens? What will happen? Choo yako itapitia.
Yeah.
Kwa sababu we have made a communication. Are you getting? Your urine will have. So we have something we call a fistula.
Yeah.
Fistulas kwa rectum, fistula kwa bladder. Yeah. So there is a mixture. Now imagine this. Kidonda ambacho kiko ndani, kwa sababu hapa si nje, hii kidonda, the cervix is not here. Hakionekani. It is inside there. Now it is inside up the vagina. So remember this, my viewer. Ndani ya vagina, God created us in a very beautiful way. In the vagina, there is a lot of warmth. There is unyevu. There is darkness. Who lights a bulb inside there? No one. So what happens? Kama kuna bacteria huko, it will grow very nicely. It has a very beautiful environment. So it continues growing. So hii ni nyungu, ni kama nyungu ya kutokota. So what happens? Kidonda iko hapo, kuna joto, kuna unyevu, si ndio? Kuna giza. So it grows and grows. In the process, imagine rotten meat. Because now that is meat that is rotting. Imagine the smell of rotten meat. Imagine the smell, you mix that rotten meat with urine, with feces. What smell is that?
A mess.
A mess.
I can only
And that is why I say cervical cancer is very unforgiving. Because you as a woman, you will be someone without dignity.
Oh yeah.
As much spray, as much cologne you're going to use, that smell is not going to go away. As much pad, as much material we are going to place there, because that is, mkojo utakuwa unatoka tu uncontrollably, feces zitakuwa zinatoka uncontrollably, they mix with now all that blood, rotten blood, you can imagine.
So it is always a huge mess.
It is a huge mess. And it is a bad smell. Apart from the bad smell, it's very, very painful.
Oh.
Now
because it's a wound.
It is a wound. You can imagine that person can't walk. This person is in a lot of pain. They cannot go for prayers like they used to do. They cannot go to church. They cannot go to vitate like they used to. And this person utamfungia kwenye nyumba, chumba cha ndani kule, kwa sababu huwezi taka aje sitting room kwa sababu ya hiyo harufu, sio? Huyu ni mama yako. Huyu ni dadako. Huyu ni mtoto wako.
Huyu ni mke wako.
Huyu ni mke wako. Now, it is preventable. And I've told you it takes 10 to 15 years for it to get to that point. Please, get screened. Screening takes only 5 minutes. 5 minutes, and I'm going to explain how screening is done. We have another way of preventing cervical cancer, and we are giving vaccination. The HPV vaccine is another way of prevention. The other thing is, if we screen you and we catch it early, we can treat it. And we treat it with some, we have several ways of treating it. Ni kama shamba tu. Wakati uko na weeds kwa shamba yako, you can either ngoa, you can either burn, you can either spray dawa. So the same thing with cancer. If we catch it early, we can either burn it. Burning it, we can burn it na moto ama to burn na freezing. You can ngoa, and you can even put dawa, and that is what we call chemo.
Yeah.
Yeah. So we can do all this, and it can go if we catch it early.
How early is early?
How early is early?
Is it in stage 1?
In stage 1 or 2, we can cure.
1 or 2?
Yes. Once it gets 3 and 4, we will just look at you and give you what we call just taking care of you.
Managing it.
Yes, we manage your pain. We manage your psychological issues. We call the pastor for you. And we make you die happy.
Guy.
Yeah, because that is the only thing we can do. Now,
that's the bitter truth.
The bitter truth. And though, you know, when we go out there and we are talking to women and we are telling them the importance of screening, they're like, oh, I cannot get screened. The screening process is very uncomfortable. How do I go when I go to the hospital? I meet a very young man. How do I do this? And I am like, we don't even remember.
Yeah.
And this young man you meet in that facility, you might go to one of our health centers or one of our dispensaries and you meet this is the only young man who is there because he's the only one on duty. Then you say, I can't get screened, my culture. I want to tell women to just leave the cultures at the door, at the gate of the hospital. They get screened, and when they get out of the gate of the hospital, they can pick their culture
and go
because if you don't get screened early, woe to you. Woe to you.
And again, that's a professional.
Yes.
And we
are bound by ethics. Whatever we see, and that is what I was telling you, we don't even see what you want, what you think we are seeing, because my interest is that cervix. And that cervix looks alike in all women. The difference is if you've given birth or not. So screening takes like 5 minutes. All our hospitals in Nakuru County do the cervical cancer screening. And in the government hospitals, we are doing it for free. Yes. If you go to private hospitals, faith-based hospitals, then you can get maybe charge kidogo. But most of these screening supplies, they are given by the government. Now they charge something we call a service fee. So the screening is, we have several types of screening. We can use a chemical we call VIA. That is visual inspection using acetic acid. What we do is we use a speculum to open up your vagina so that we can see the cervix. What I tell women is they cannot see their own cervix. It's not like the breasts when you're going to shower. You will look at it and say, oh, it changed. But for a cervix, huwezi jua ikibadilika. So ni muhimu uende na tuna screen, tunasema kwa watu ambao tunasema general population, tunasema you can go for screening 5 yearly. But for this person who lives with HIV, the viruses, this person is supposed to be screened yearly. This is because this person who has HIV has lowered immunity. So immunity yake iko a bit low. So if the immunity is a bit low, this person cannot be able to fight the virus as much as this other person who does not live with HIV. So the other people can go 5 yearly, but this other person who lives with HIV is supposed to go every year for screening.
Every year?
Every year. So we use a speculum. I wish I even carried that speculum for me to show the viewer, because they say, oh, they put metals inside, that is why I don't want to go. No, that metal thing we use to open the vagina, nowadays we are even using a plastic one, the disposable one, so that once we use, we just dispose.
Thrown away.
It just opens the vagina so that you can see. I tell women, even your husband cannot see your cervix. Your husband just imagines they are touching the cervix.
Okay.
Because maybe they feel something like the nose when someone is having sex, and they're like, oh, maybe you're touching the cervix, but you cannot know, and you will not know. It is not like your vagina, you look at the mirror and say, oh, I'm having some changes. And I always tell women, it is important to know your body.
Okay.
I know the people are like, oh, it's a taboo. Oh, it is very important to know your body. Because tomorrow when you see you're turning to be light, don't think you're light-skinned. Yeah, something could be happening.
And you have always known yourself to be like this.
Yes, and then tomorrow you're like,
something is happening.
Something is happening. I've always told women, please kindly just take a mirror and look at your vagina. I mean, tomorrow when you see flowers in your vagina, God never created flowers down there. So it's very important to know how your body is naturally. So when things start changing, you can know there is something changing and you can seek for medical advice.
Is that the same case with the breast cancer?
Yes. So the cervical cancer, we screen using Via Vili. We can also do a pap smear. So what we do, once we visualize the cervix, we just take a sample of cells and then we take it to the laboratory to see if we are having the viruses, the HPV viruses, some subtypes. Because HPV virus has like 72 plus subtypes of viruses. So, but there is this type 16 and type 18 that causes the cervical cancer. So with the breasts, now the breasts, the cause is idiopathic. We don't have like the cervical cancer. We know 99% is the HPV infection virus. But for the breast is idiopathic, and mostly family issues. Maybe if there is a family history, maybe you've exposed yourself to radiation, you know, things like that. So for breasts, it's very easy to know you have breast cancer. So for the ladies, it is very important to check yourself. For cervical cancer, we've said 5 years for a normal person who is not living with HIV, and yearly for a woman who is living with HIV. But for breast cancer, we are like, check yourself every month. But we are saying, check yourself a week or 2 after your menses or before your menses. Because when you're almost getting your menses, the hormones, there is buildup of hormones. So there is fullness of your breast. So you might touch and feel pain, and you're like, oh, there could be something. But it is because of the hormone surge. So it is important to check 2 weeks before, 2 weeks after. Yeah, that is midway. So how do you check your breast? You want to see if there is any lump. You want to see if there is any skin changes. You want to see if there is any dimpling. You want to see if there is any discharge. And how will you do this? It is very easy. I always ask women, how do you check your breast? And someone starts just touching their breast like this. No, you don't.
Not even looking at it.
You don't just touch like this. See avocado, tunaangalia kama imeiva. It is, you want to check your breasts in the right way and systematic. First of all, know your breasts. Kindly know the color, so that tomorrow when you stand in front of the mirror and you're looking at your breast and you see one part is so dark or one part is so bright or brown, you will know something is happening.
It's not okay.
The other thing, know the sizes of your breast. Tuache kuacha tu wanaume wanatushikia matiti. You need to know your breasts. Now someone else told me, I don't know, but you ask the husband how the breasts are, they will describe the breast of the wife. But it is very important for a woman to know their breast. So know the color. The first thing you do, stand in front of a mirror, topless, right? Look at your breasts and look at the size. Naturally, the breasts of women are not the same size. So, but they are not, one is so big and the other one is so small. Then the next thing you want to do is you want to lift your hands pole pole too, as you're looking at your breast, to see if they are rising at the same level. So if one breast is being left behind, know that it is fixed. When I am lifting my hands like this and my breasts are not moving at the same level, that means one that is being left is fixed. And if it is fixed, there is something that is fixing it. There is a lump that is fixing. So that is the first step you do. The next thing, you want to look at the color. Just the color.
Okay.
If there is any changes, kindly come to the hospital. The next thing, pick one breast. You can raise your hand. We raise our hands like this so that you can stretch this muscle. Remember, our breast is a muscle tissue with a lot of fat.
Okay, so what you'll do, you can just hold it right here.
Okay.
Just before we explain the process,
Yes.
we take a very, 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 very short break.
Okay.
And then we'll be coming right back. Remember, we are talking about breast cancer, we're talking about cervical cancer. We've said it's very important to screen. And when you catch the cancer early enough, then we are able to treat it. Nasa ametuambia hapa, when ikiwa iko stage 1 or stage 2, it's very easy, it's curable. But ukingoja mpaka sasa imefika mbali huko,
it's another story altogether.
Very sad because we can't now treat it. Okay, so we go for a very, very short break and then we'll be coming right back. Usiende mbali. All right, we are back after that very, very, very short break. Tumetoka madukani, and we are still here with the nurse, and we are talking about cervical cancer, breast cancer screening, which is very, very, very important. And naona already we have some questions that are coming in. I hope we'll have enough time to answer all of them. Before we went for that very short break, tulikuwa tunasema there are ways ambayo you can test we mwenyewe kama uko na breast cancer. And you say that you should know the color, right? So that ukiona any change, wewe ndio unajipeleka pale hospitalini. We also said the size, it's very important ujijue.
So I was explaining the procedure of self-breast exam. Tunasema self-breast exam. There is a difference when you check your breast yourself and when we check the breast for you in the facility, in the hospital. So that one we say clinical breast exam.
Okay.
So for self-breast exam, as I said, you first look at your breasts, look at the size, and you also lift your hands, as I was explaining. Uangalie kama matiti yanasonga kwa usawa. Alafu ni vizuri kuangalia tuone kama kuna uvimbe wowote. And I said the importance of raising. You know, people always, when you ask them, how do you check your breast, and they just lift. It is important to always know the rationale. Why are you doing whatever you're doing? Wakati unainua huu mkono hivi juu, unanyosha hii nyama. You're stretching this muscle so that it is easy for you to be able to palpate. So wakati una palpate titi lako, unatumia the pads of your fingers. Don't use, usifanye hivi. You use the pads, this. And then you just go round. You can choose to go round. You can choose to go straight down. Bora uhakikishe umekava titi lote. So when you're doing this, you're trying to see kama kuna uvimbe wowote. So you make sure you go around the whole breast and also under the armpits. That we also have breast tissue under the armpits.
Okay.
All this muscle is a breast tissue. So you make sure you do that and you go to the next breast. And you go round too. Ukisikia uvimbe wowote, kindly come to the hospital. We are not saying that is cancer. We are just saying come to the hospital. Yes, because wakati uko na hormone surge, sometimes it makes you have lumps kwa hizo ducts, the milk ducts. So ni vizuri uje hospitali. The next thing you do, then unafinya chuchu. You want to see what comes out of that breast. If you're breastfeeding, what will come out? Maziwa, definitely. If you're almost getting your periods, what will come out? Maji. If you're pregnant, what will come out? Maji. But if you see maji ambayo yanakaa kama strong tea, come to the hospital. If you see blood, if you see pus, come to the hospital. If you see any of that discharge, kindly come to the hospital. Okay. Then when you come to the hospital...
For the one who is not pregnant, Abu, take that again.
Okay. When you're checking your breast, we are looking for several things. We've said color, sindio? We've said the dimpling. Ukiona pia titi lako liko na dimples, don't think God gave you dimples on your breast and go showing off, hey, I have a dimple here. No. Kindly come to the hospital because that dimple, hiyo ni nyama imevutwa ndani na aka growth.
Okay.
So it's important to come. Or imebadilika ngozi inakaa kama ngozi ya chungwa ama ngozi ya ndimu. You see the way ndimu is the skin. If you see your breast skin like that, kindly come to the hospital. So I was saying when you're palpating. Now when you're finyaing the nipple, of course, when you're not almost getting your menses or you're not pregnant, nothing will come out. Or you're not breastfeeding. But when you're breastfeeding, milk will come out. Milk is normal. When you're almost getting your menses, when you squeeze your nipple, itatoka maji kidogo, that is normal. When you're pregnant, ukifinya itatoka maji, that is normal. But if you're not pregnant, if you're not almost getting your menses, alafu ufinye itoke maji na kaa kama strong tea, maji ya uthurungi, tafadhali njoo hospitali. Ukifinya utoe usaa, njoo hospitali. Ukifinya utoe damu, njoo hospitali. We do further tests. Because we are not saying this is cancer, but we want to check it further and see. Now we can take some tissues and take to the laboratory for histology. Sawa sawa.
Okay.
So,
sorry, before you continue, is it also for men?
Yes.
The breast cancer?
Yes.
And the same process?
Yes.
Okay.
For men, they don't have to choose at 2 weeks because they don't have their menses. For men, they can decide, I was born on 2nd. Every 2nd, they check their breast because even men get breast cancer. But for men, it's very easy. Their breast tissue is not as much, it's not as fatty as ours. So, yao ni rahisi kuangalia. But again, squeeze and see what comes out. Because we've seen men getting breast cancer and men think they don't get breast cancer. Even men have breast tissue. So it's very important too. And then choose one day. I always tell people, choose a day in a month to come to the hospital, not only for cancers. Come get your BP checked, come get your sugars checked. For men, come get your breast checked by someone else so that we can see what is ailing you. Because some of us are dying of something they've been ailing for so long na hawakujua, because they thought they were okay, and then just someone collapsed in the bathroom and you're like, oh, this one collapsed and died and this person has never gotten sick. It's because they don't come for checkups.
For checkups.
Yeah, so it is very important to come for checkups. And in our facilities, we are not charging. The government, the county government of Nakuru has zimetoa hizi huduma zote bure, unless now you go to the private facilities and FBUs where you're going to pay a little charge for just so that they can pay this the workers. But it is free of charge. And I said it is 5 minutes. 5 minutes.
And you're done.
And you're done. Now the other thing, once we get for cervical cancer, once we get your cervix is changing, we treat it there and there. We are not referring you to PGH. We are not referring to Naivasha. All our level 4's facilities, the health centers, the ones we call, and some of the dispensaries have what we call a thermoablation machine. So once we see your cervix is changing, we treat it there and there. Imagine. And we won't send you to PGH. So I don't know why we are getting scared as women, but I want to tell women out there and men, because this is our sisters, this is our girls, this is our wives, and this is our mothers. Kindly, waje hospitalini wapimwe.
All right. So I see you have a question here, and Oliza, does it have signs, symptoms, or is it unnoticeable? I think you're asking about both cancers. So Oliza, does it have signs and symptoms, and is it noticeable? Ama mpaka sasa ifike uko stage 3, stage 4 ndio uta realize? Now,
thank you very much, Jean, for that. It's an omission actually. There are signs and symptoms, but for cervical cancer, you will start seeing the signs and symptoms when you're in stage 3. One to you. When you're in stage 3, stage 4, that is when you start getting the signs. And these signs could be you're getting your menses in between. You got your menses last week, then you start bleeding. Then the other thing is could be pain during sexual intercourse. You were not feeling pain before, now you feel pain. Backache, kufura kwa mguu mmoja. Those are signs that you will start seeing, and a very bad smell discharge that comes from your vagina. And those things were not there. When those things start happening, woe unto you. Because once we come and check, it feels so bad.
Yeah.
It feels so bad for me when I screen you and I know deep down there is nothing I can do for you. I'll just tell you now, the only place I can refer you to is PGH. Then you start either chemo or we give you palliative care. As I told you, we just now. And it is so sad.
Yeah.
And is it the same, the signs for the breast one?
The breasts, you will see a lump.
A lump, yes.
Or you feel pain, or you start seeing skin changes, or you see a wound. And when you see a wound, it's too late. And I'm like, breast is something that you see. You know, you won't see a dimple and keep quiet. Maybe you will keep quiet because you don't know. And nowadays, it's very funny. Some people are getting breast cancer even without those signs.
Oh.
Yes, you won't see dimpling, you won't see any growth, but you just start having other symptoms, like you're getting fatigued all the time. You don't know why you're getting fatigued. You know, it can't be explained. But we are saying, why don't you go to the hospital once in a month and do a wellness clinic? Because we will do a blood check. When we do a blood check, we will see some of your parameters are going down, and we know when your leukocytes are down, when your white blood cells are down, we know something is happening. Something is happening, and we will dig deep.
Okay.
Yeah, it's very important.
Okay. Wow.
Yeah.
Get screened early. Kuna haja ukae mpaka it's too late.
Yeah.
And then, as you said, you're screening and you know there's nothing you can do about it.
It is so sad. It is so sad.
Yeah.
And I always tell the healthcare workers in the facilities, it is also very sad when women have been passing through your hands and you're not talking about the screening, the importance of screening to this woman. This woman has brought their child, maybe they are sick, or this woman has just come for their family planning method. Talk to them about screening.
Yeah.
Because if we don't talk to them about screening, again, we are advocates of these people. And once you are an advocate of this person, you're supposed to give them information.
Yeah.
Yes, and tell them, explain. I always show the women a speculum. This speculum, they get so scared about. The head of a baby passed through the vagina yawa. Hii speculum ni kadogo sana hii ya kufanya uogope. And it's only like
for around 5 minutes and you're done.
And you're done and you're gone. And once you're told you have a clean bill of health, you feel so good.
And you know, prevention is way much better
than cure.
Than cure.
Curing cancer, any cancer, is very expensive. It's very expensive. And for now, you go to PGH, the queue that is there, awaiting, you are put in a waiting list. Wakati utawekwa kwa hiyo, you know, our cancer center, as much as it's beautiful and big, we have so many patients. So you can imagine uko kwa waiting list. Na ugonjwa haingoji. Inaendelea kuprogress. Exactly. It goes on progressing. And then you die for something you could prevent. And that is why I say, kindly, come for screening. Come for screening. And when you're coming for screening, when it's too late, it kills us. Because there's nothing we can do.
And because you're also human and you know.
Alafu unaanza kuitana mchango, kitu ambayo And then when we are telling people to bring their girls for HPV vaccine, it's like the government wants to control the population. No. If the government wanted to control the population, they would have put it in water. Everyone takes water. Or in Panadol, because everybody takes Panadol when they have a headache. So they cannot put it in a vaccine control. Let the girls get vaccinated. And for women who have outgrown the guidelines, like we say, we are giving the 10-year-olds the vaccine. 2 doses. For women who have outgrown the 14 years, they can also get the jab, but not the one we are giving our girls because of logistic issues.
Okay.
So huyu anaweza enda afanyiwe HPV test. Kama hana HPV virus, anaenda kwa gynecology, anadungwa. It's around 12,000 a dose. So once you're getting 2, that is 24,000 in the and now we are giving our girls for free. And then you want to wait. Ukiwa mzee kama mimi ndio unataka kudungwa HPV. Kindly let your girl get vaccinated and let yourself get screened and do a self-breast exam every month for both male and female. And visit us in any of our facilities, any corner of this county. We do it. Any level, whether it is a dispensary, whether it is a level 5, we are screening. Karibuni.
Thank you.
Wow. I see.
Hapo tumekuwa darasa 100%. Sijui kama nitaisahau.
I know. Mwelekezi at some point alikuwa ananiuliza, can we pause, then we go get tested, and then we come back continue because at this rate. But it's also good you told us that the people wenye wanatakana kwenda kutestiwa, all the ladies, just go get screened. It's very important. You said below the age of what? They go get the HPV.
The HPV we are giving 10-year-olds to 14-year-olds.
10 to 14.
To 14. And then for screening, for the girls that have started their sexual debut, we can screen. But for the HPV virus before 30 years, it is self-limiting. Before 30 years, you can fight it very well. After 30 years, that is when we start getting worried. Because for HPV, once we screen you and we find you have the HPV below 30 years, that one will, the body will get rid of it. But again, it's important to come get screened if you have multiple sexual partners and you're below 30 years. We can do the Viavili. Because the more men who you're having sex with, the more viruses you are prone to exposing yourself to. Yes.
Okay.
Wow, okay.
There's a lady here.
That, okay.
Anauliza, anasema my periods usually on the first day inakuwa brownish. Is it normal? Ama inaweza kuwa anything cancerous?
No, that is very normal. That is very normal. We have different colors of menses at different times. So brownish at the start, brownish at the end, it's normal.
All right.
Okay. I think most of the questions tumezijibu during the interview. So I think we are good to go. But if you have any other question, please tell us where they can find you or any other facility.
We have facilities all over. And the good thing about Nakuru County, tuko na facilities every 5 kilometers, less than actually. Like Bondeni here, your neighbors, Bondeni Dispensary and Bondeni Sub-County Hospital is less than 5 kilometers. So they can visit any facility for information. And what I want to tell the men, wasianze kusema, yay, at the HPV we are the carriers and we don't get anything. HPV virus can also cause penile cancer for the men, but this takes a bit long. For people who have sex, anal sex, you can get anal cancer. For people who are having oral sex, you will get oral cancer.
Dangerous.
Yes, and the warts, the vaginal warts, all those is caused by the HPV virus. So kindly, all of us, let us be vigilant.
All right.
There you go.
Thank you so much for joining us today. I know that we've all known what you're supposed to do, and as you've had, kuna facilities every less than 5 kilometers. So go get checked, go get screened. It's very, very, very important. Today you had such an amazing show, and we have learned a lot. Now, acha tupate today's inspiration. Tuone mambo yako namna gani. The other side, of course, unajua ukiona today's inspiration, tunaenda kumaliza today's show. And as you can see kwenye kiwambo cha runinga yako, today's inspiration being date 6 of May 2024. Today's inspiration inasema ya kwamba, don't watch the clock, do what it does. Keep going. Such an amazing one. Don't watch the clock, do what it does. Keep going. Don't stop. Hashtag Blessed Monday, and of course Nindani, today's inspiration. Tell us a little bit about what you're having then here.
Financial Monday. I'll be having Mr. Gidenji with the continuation of what we tackled some time back. So it's going to be an amazing session there. So make sure that you don't miss. By the time in Agonga 10:30 this very morning, Mr. Gidenji will be here, and I know Yakwamba is going to give you an insight when it comes to wealth creation as a believer, what you need to do. And yesterday, the man of God shared a very powerful testimony, a very powerful word on why it is very, very important to partner with God, and what you do as a believer, that giving in this era, is by grace, si kama vile ambavyo ilikuwa ni sheria katika Agano la Kale. And even he was taking time to really explain why even Jesus and the disciples did not really, sukuma sana on the issue of giving. And it was a very, very, very important topic. So today we might also touch on that in one way or another, because it's all about finances. And I believe ya kwamba utaweza kubarikiwa sana. Kwa hiyo, by the time inasema ni kugonga 10:30, I'll be here. And Mr. Gidenji will be here as well, and that conversation, I believe ya kwamba it is going to be very, very key. If you remember, ni kwamba last time wakati ambapo alikuwa hapa, alikuwa anatuonesha pia kando na kwamba you're a believer, when you go to the marketplace, some of the things that you can do to make sure that also you are competing with your competitors, not in a bad way, but also to make sure kwamba the kind of business that you're doing inakupea faida. Because why do we do business? You pata faida, and also for you to really give an answer to that problem that is really disturbing people there. Naye Pastor Kamau tumekuwa naye katika wiki mbili, ambapo alituambia, when someone asks you why you do what you do, you tell them you do it because you want to succeed. You don't do what you do just to pay the bills. You do that with an aim, ya ku make sure kwamba pia umeweza kufaulu katika kile ambacho unakifanya. Kwa hiyo that is what we'll be doing, and I believe that it's going to be amazing. Of course, ndani ya siri mafanikio tutakuwa pia tunaangalia why it is very, very important to say no. But also there are people we have spoken to, and we are asking them today, wakati ambapo umepata pesa, what is the first thing that you do when you have, umepata mshahara ama you have done something and there is money? What is the first priority katika bill zako zote? Nini hiki ambacho unakipea kipaumbele cha kwanza, and why? So that is what we'll be discussing, and of course that will be very, very key. Tomorrow ni Tuesday, na Tuesday ni siku ya mahusiano, and if you remember ni kwamba we had a dilemma last week. And we are hoping that tomorrow we might have a guest to come and explain more. Kuulizana, is it okay? Maybe you're in a relationship and that friend, your friend, the person that you're in a relationship with, akona beshte. And maybe this person tells you something about maybe what is happening in your relationship, and especially when things are not okay. Can you act based on that information from their friend? Maybe kama ni mpenzi wako, you're a man, and maybe the person you're dating, kuna vile ambavyo amekuwa behave in a way that you don't understand, and then maybe you go to the best friend, and then the best friend tells you something. Unaweza act based on that information, a relationship is just for two people, and the moment you start involving a third party, things go south. Now it applies hata kama you're a lady and there's this guy that you're dating and his friend, and maybe somehow there's a clarity you're not getting from him, and somehow you find yourself asking the best friend, and maybe the best friend tells you, kama mambo imefika hapo, naona nikana kwamba inafaa ujipange. Now based on that information from his best friend, unaweza chukua hatua, ama you have to be there until himself says, this is what I think, this relationship is not working, and we have to go our separate ways. Ama you wait, ama useme kama best yake anamjua, then I believe whatever the best friend has told me, that is the truth. Then because of that, I'm going to just do my thing. I don't care. Hata akikuja baadaye, unamwangalia tu kwa macho ya, if you knew, nishaambiwa everything. So kila mtu ajipange. So that is what we'll be talking about tomorrow. And let me also tell you, takasikio ya kesho is I don't know if it's going to be hilarious or what. I already have it. Yep, but itakuwa drama of its own kind. Kamiti remains to be my very good name. Sitaenda sana. So in the next like 30-something minutes, I'll be coming back here and then yeah, Financial Monday.
All right. So tutakuwa tukipatana na wewe at 7:30 in the PM today. Ndani ya hapa tu MBCI TV, we'll be talking about fuchsia movers in the business plus. So episode ya leo ya business plus is very, very, very intriguing because you're talking about a business that is doing so well lately. Ni biashara ya movers. When people are moving from one apartment to the other, from one house to the other, mostly we used to call for transport. Mtu akona lori, mtu akona blah blah blah. Then you call the people when you nataka wakusaidie kubeba vitu, your friends, your family, and then you move. But for this particular episode, you're having fuchsia movers. Fuchsia movers is a company who are doing transport, moving and transport jobs. So if you're moving from one place to the other, they'll do everything for you. In fact, the very interesting fact is they can move you from one apartment to the other, from one house to another, or from one office to the other, even in your absence. Wewe waambie tu, you're moving from this house to this house na unataka ikuwe ready by this time, and then go do your business. Ukikuja jioni, you'll come back to your new home, your new palace. So we'll be talking to fuchsia movers. Make sure you don't miss that episode today at 7:30 in the PM. And then after that, I'll be seeing you again tomorrow, God willing, hapa ndani ya Raushwa from 7:35 in the AM. Until then, God bless you. God be with you. Usiende sana. In the next around that something minutes, we'll be coming back for the Financial Monday.
And now may the grace of our Lord Jesus Christ and the love of God and the fellowship of the Holy Spirit be with us now and forevermore.
Amen. And
Amen. Raushwa Monday edition inafikia mwisho hapo, so tukutane ndani ya Financial Monday.